Good day and welcome once again on this YouTube channel. Thank you for joining me so far. I want to thank you, my subscribers, my viewers, and returning viewers. Thank you so much. As I told us before, that the reason why I created this platform is to contribute my own quota towards health awareness in our environment, in our society, in this part of the world. And this is based on the few experiences that I have gotten so far since I started practicing medicine as a medical doctor. And then that's just the reason. Essentially, this platform is not for lectures. I'm not giving lectures here. It's just to sensitize people. When the time comes for lectures, I will let us know. I created this platform to give as much as needed health awareness concerning pressing health issues and other related matters that may be necessary in our society. So today, I am talking about Widal test and the abuse of antibiotics. That is the reason why we are here today. Now, in this part of the world, whenever somebody is running temperature, having bitter taste, having headache, and maybe becoming weak, they will run to the hospital. Most times, they may not go to the hospital. They will go to the lab, maybe one side labs along the road, and then do tests. One of the most commonest tests that is done in this part of the world is Widal test. Widal test. And then most times the result will come out to be positive. That is showing that the result is significant. They will say Widal test or Widal agglutination test is significant. You understand? So now I want to break it so that you understand that Widal test is a highly sensitive test and it is not specific. The reason why people used to do those tests is that they will say, I have typhoid, because the result is positive or significant. They will say the person has a typhoid fever or has a salmonella typhi. Do you understand? So I want to enlighten us to let us know that Widal test is not specific for enteric fever. It is not specific. So that you will stop abusing antibiotics. You will stop abusing antibiotics, because what happens most times is that because the result is positive or the test is significant, they will place those persons with some antibiotics, ciprofloxacin and other things, and then they begin to use those drugs, and the thing is becoming in episode, becoming recurrent all the time. Anytime somebody is sick, somebody is having fever, running temperature, they will run to the lab, and then next thing you will see the person with antibiotics, ciprofloxacin and other antibiotics as well. That's why I'm making this video, so you know that those things are not specific. Widal test is not specific for enteric fever, for typhoid fever, because there are other things. There are a number of things that can give you positive Widal test, and it's called false positive result. Number one is malaria, which is endemic in this part of the world, in the tropics. Malaria is endemic, like it is living with us. Malaria is living with us. Most of us, we have malaria. 1+ of malaria. If you go for test, you have 1+ of malaria inside of you. So now, if myself that is sitting down here should run Widal test, my result may come out to be significant because of exposure to plasmodium. Exposure to the plasmodium, that is the agent that is causing the malaria itself. Do you understand? So it is one of the things that can also cause you to have significant Widal test, or for your Widal test to be positive. That is malaria. Then another thing can also happen is vaccination, like BCG vaccination. Those ones we used to receive those days, and then when we are small, for tuberculosis. It can also give you a false positive Widal test result. Do you understand? Then recurrent upper respiratory tract infection, we can also cause you to have this Widal test to be positive in your system. Recurrent upper respiratory tract infection. Because when you're having upper respiratory infection with viruses, your body will begin to secrete antibodies, and those antibodies can cross-react with this reagent that you use in the Widal test, and it can give you a positive result, which is a false positive result, and then you begin to treat typhoid and begin to abuse antibiotics. And you know that most times within this part of the world, we usually used to have a upper respiratory infection. Sometimes you are having catarrh, you are coughing, and you're not coughing out anything. You are running temperature. When you go for maybe proper examination, you see that there is nothing happening in your chest, in the lungs itself, but you are having upper respiratory infection. You're having catarrh. You're having running nose. The antibiotics also that you take as well can also cross-react by stimulating production of antibodies in your system, and that will give you a false positive result in the Widal test. You understand? We give you a false positive result with that test. Do you understand? There are other things like chronic hepatitis. If somebody has a chronic hepatitis, that can also give you a false positive result with that test. So there is no need of abusing antibiotics. It's not every time that you are running temperature, that you are having headache, you are having weakness, you are feeling that you are ill, that when you run the Widal test and it's positive, you start taking antibiotics. No. If you want to confirm whether you have typhoid, some other typhoid inside of your system, what you do is you do blood culture. In the first week that the symptoms started, you run blood culture, or subsequently you can run a stool culture, bone marrow culture, to culture the microorganism that is causing the very this thing. When you run the culture, you now see the growth of that very bacteria or bacteria, as the case may be. Do you understand? So that is not every time you are running temperature you start taking antibiotics. The abuse of antibiotics is becoming much in our society. Do you understand? It's becoming much to the point that sometimes when you now start giving the usual antibiotics they used to treat some bacterial infection, there won't be response. You now need to go to higher drugs like meropenem. So that is the essence of you listen to this video. Please, let's stop abusing antibiotics in the name of I have typhoid, because with that test is positive. I have mentioned series of things that can give you false positive result with that test. So that is idea behind this video today. So I want to thank you for listening, and I want to thank you for watching this video. Please support us by sharing our videos so that other people can see. Now, if you like what we are doing, like our video, because when you like our videos, it's going to propel other people to see what we are doing, so that they will learn from it. Share this video to your relatives so that they will learn and know that some of the things we are doing, we are the ones that are going to cause our own very brain. We should not cause damage to our health. So I want to thank you so much, and may God bless you as you listen to me and share my video. Thank you. I appreciate my subscribers, my viewers. Please, as you're viewing, kindly subscribe. Hit the subscribe button to support us so that more people will see our work. Thank you.